and welcome to all of our Gold viewers who are here with us today. I'm Kristin Schwartz, licensed midwife and one of the MCs here at Gold. And today I'm talking to Kristin Cavuto. Hi, Kristin. It's good to have you here with us today.
I am so happy to be here.
And you are, of course, part of our Gold Lactation online conference for 2025. That's just around the corner. We get started on April 1st with our keynote presentation. Your presentation in the conference is titled A New Normal Lactation Through Divorce and Custody. It is really a very, very important topic and one we don't, I feel like talk enough about. But first, before we jump in, tell us a little bit about you and your professional background.
Sure. I am a licensed clinical social worker and IBCLC in joint private practice in central New Jersey. I see lactation clients. I see therapy clients. I see individuals. I see couples, and I see larger families. And I also have a side gig, I would call it, as being an expert witness in court cases, mostly involving lactation and child welfare, which makes good use of both my social work degree and my experience as a lactation consultant.
Yeah, and that's such an important role to play. I can imagine it's not always easy being a witness there, right? It's a lot going on in court cases, of course, and yeah, but it's good to have the expert there for, making sure that evidence-based information is given and, supplied to
Yeah,
this.
I do the best I can to educate the court, as in that role. It unfortunately is not easy and does not
Mhm.
always they're not always doing what they need to do in favor of the baby who we're trying to
Yeah.
advocate for.
So, Kristin, how do you balance that? When you see something like that, it probably is very difficult. It goes to your heart because you're very passionate about what you do. And what do you do to keep yourself centered and balanced? How do you cope with that?
I think the past, almost 25 years of clinical practice, both as a therapist and as a lactation consultant, has taught me how to be incredibly emotionally invested in a process, but also maintain my own peace, my own serenity inside a whirlwind.
Yeah.
It feels a little bit different being in a courtroom than it does being in a therapy room, working with a client. But there's often, we work with clients who are often having a really hard time or in
Okay.
tears. Sometimes things are bleeding, things are leaking. Being a lactation consultant is messy sometimes.
Yeah.
So all those skills have made it not easy to be in a courtroom, certainly, but it's prepared me for it.
That prepared you for it. Good. Yeah. Thank you for sharing that. Yeah, your presentation, as we mentioned, is about the lactation through divorce and custody. A tough topic, right? It's not an easy topic. It's not a happy topic. There's a lot going on. There's a new child, a new baby, the family is going through the process. It's very probably emotional, and often the parents still recovering from birth in some cases, right? I mean, the hormones are still also playing into that. Um, so, I can only imagine. So, talk to me a little bit about this, how this parental separation or divorce has an impact on breastfeeding and lactation.
Sure. I mean, the most obvious answer is that when parents break up, whether it's legal divorce or not, we have to deal with separation between
Hmm.
the nursing parent and the baby,
Hmm.
oftentimes. And that separation could be a wonderful setup where it's a few hours a day and the baby is supported and lactation is supported. And it could be a setup in which, a 12-week-old baby is given 50-50 custody with somebody who is not a great parent, and that the nursing mom just has to deal with the fact that she only has her baby half the time, and that's really hard and really heartbreaking.
I can imagine. Yes. Speaking about like also, custody agreements, how often is that written into them, or, what is the process there? Because, that's an added layer to the whole process, right? Like, how does it usually look like?
In my experience, unfortunately, most family court judges don't care a whole lot about breastfeeding. And especially once the baby gets towards a year and certainly after a year. Um, not only do they often not take it into consideration, they often look at it as a negative if it's brought up when the older the baby is.
Wow.
Yeah.
Yeah. Oh, that's very sad to hear, that it's yeah. And that's why we need more education. We need
Right.
everywhere, right? Like
Hmm.
breastfeeding education, not only for the parents we serve and but for the whole society as such.
Absolutely. Yep. And this
Uh,
is where lactation consultants who understand
mm,
how to write a letter of advocacy, which is part of what this presentation is about, not about becoming an expert witness per se, but about how
mhm,
to contribute to a
yeah.
client or a client's case in a way that will help educate the court. And so that's something that we can do as
Uh-huh.
IBCLCs. We can help educate the court about what normal lactation looks like, about what is appropriate from the developmental standpoint for a baby of a different age, a toddler of a different age. These are things that are within our scope of practice, and we can be helpful.
Right. And, let's talk a little bit about roles here for IBCLCs, lactation care providers. You mentioned that education. What other roles can we play? Or can they play without or with staying within scope of practice? Because I can imagine IBCLCs who are working with families, that might be one of the concerns to how do I practice safely and respectfully, but also stay within my scope of practice.
And that's a lot of what I'm going to be talking about. For somebody who is an IBCLC and is not also a clinical social worker or has another degree that would actually speak to child welfare,
Mhm.
we can educate on lactation and make recommendations for best practices in lactation without getting into scope problems like
Mhm.
assessing parenting skills.
Mhm. That's a very good point that you're making because it's also probably a lot about still also boundaries, right? And
Mhm.
knowing where what your scope is and where you're not. And this is also, especially talking about emotions, right? Because as an IBCLC or lactation counselor, we get invested, we get, very passionate about what we do. We want, of course, the best for the family, for the baby. And, there, as you mentioned, there might be critical cases where it's not always the best of separations scenarios, so to keep our own bias or what we outcome that we hope for is not always what's happening in real life, right?
And that's one of the things we're going to be talking about, how to understand our own biases around the ideas of divorce, around ideas
Hmm.
of separation between a nursing dyad, around bottle feeding, our biases around formula use,
Yeah.
etc.
Yeah.
And to make sure that we're also looking at a lot of us have personal trauma around the idea of divorce, either from our own childhoods or from
Yeah.
our relationships
Yeah.
as adults. And that trauma that we had been through can impact our ability to provide good care in these circumstances. So one of the things we're going to talk about is how to accept the fact that a lot of us are hurt by the idea of divorce and child custody issues, and how we can still be helpful in that
how
situation.
how we can still be helpful and working despite our own trauma or experiences. Yes, so important. What can you advise if a lactation IBCLC feels uncertain about handling cases involving separation and custody, saying like, oh, I don't know if I'm really equipped for that. Can I do additional training? What resources, what can you recommend?
Well, this talk is a great place to start.
Okay.
Certainly, if somebody finds that they're very interested in learning more, any education they could get on infant mental health would be a great way to
That's a
start.
good
We talk a
point.
lot about perinatal mental health, meaning talking about the birthing parent. We don't talk a whole lot about infant mental health. That's a
That's
whole
right.
other field that people can get trained in, take some classes in. That would be helpful.
Mhm.
Yeah, that's where I would start with. I mean, certainly there's information on how to be an advocate in a legal setting that someone can take trainings on as well.
Perfect. Thank you. That's wonderful information right there. Kristen, before I let you go, any last wise words for our viewers about the topic?
This topic sounds really frightening when somebody comes to us and says, I'm getting a divorce and I'm worried that my soon to be ex-spouse is going to, take this nursing baby away from me. What do I do? we get it pulls on our heartstrings. This is exactly the kind of situation that gets lactation professionals very upset. It's important that we learn how to deal with those feelings and to actually be able to provide support, provide education, and provide actual clinical lactation help to a person who is in this situation. We're also going to be doing some conversations about how to help people who will be having separation for visitation to, work with pumping, work with what for them will be a new normal of what is separation like and how can we make it the easiest it possibly can be.
Wonderful. I know this is going to be a great presentation, so much great information in there for our viewers and so much to look forward to and to learn about this topic. Thank you so much, Kristin, for being here with me today. And we're all looking very much forward to your presentation during the Lactation Conference.
Thank you.
And now some information for our viewers. If you are interested in this presentation and want to learn more, and also to learn more about all the other presentations at the conference, we invite you to go to goldlactation.com. We get started with our keynote presentation on April 1st. This keynote presentation is open access and available to everyone. So you find the information how to sign up for that one as well at goldlactation.com. And I hope to see everyone at the conference. Thank you so much for watching. Bye-bye, everyone.